Welcome back to Open Your Eyes. We're having our second conversation this morning, and as we mentioned, it's all about World No Tobacco Day. That's the discussion that we're jumping into right now. And to assist us with that conversation is Esner Veas, and he is the director of the National Drug Abuse Control Council from the Ministry of Health and Wellness. Good morning, Mr. Veas.
Good morning.
Good morning.
And welcome.
Good morning,
It's always a pleasure to be here at Open Your Eyes, especially in this different type of setting.
Yes, I have to say, welcome to OIE Escapes. We're traveling. We're on the road.
That's excellent.
But let's jump into the conversation, because I always appreciate having a chit chat about this particular topic, tobacco, and the effects of tobacco on society in general. Before we even jump into those effects, what is tobacco?
Okay. Tobacco is one of those legal substances that for us at the National Drug Abuse Control Council we take very seriously, because it's one of the substances that is highly addictive and very readily accessible, right? Not only to the adult population but also to the younger population, because whereas it's a legal substance, it's one of those legal substances that is less regulated, if you want to put it that way. So when you look at the accessibility of the tobacco products, you're not only looking at tobacco as we traditionally know them, like the cigarettes, the Fanta and so forth, but we're also considering a tobacco product, all those new and emerging products, such as electronic cigars, such as hookahs, and things like that. Because these substances also need to be part of that conglomerate product that, as we, in one way or the other, look at how we can make sure that we create a policy that would regulate, but not only regulate, but also to use that policy to protect the lives of all those individuals who consume these products, but also who do not consume, but also are affected via second-hand smoking or third-hand smoking.
I want to look at the legality of tobacco, as you mentioned, because this is a drug that is readily available, as you mentioned. Let's take it all the way back to when it was considered sexy or cool to smoke, or when you could have smoked in your workplace, you could even smoke on a plane. Let's talk about, perhaps if you do have some history on what in the first place brought about tobacco as a legal drug, knowing that there were all of these side effects.
Well, the tobacco industry has played a major role in ensuring that these products are, in one way or the other, sexy and attractive to
marketing.
Through marketing.
Great marketing.
Through the course of history, right? And with the inception of social media and all of that, the tobacco industry has used that as a way of how to ensure that through marketing and social media marketing, more young people are addressed and are looked at to ensure that they would be able to consume these products in a way that the industry would create marketing strategies that would say in one way or the other that these products are safe. But at the end of the day, whether it be traditional tobacco products or new and emerging products, they still cause the same effect. When you look at tobacco or cigarette, in essence, you're looking at almost 3,000 chemicals that are in those products that may cause a higher kind of health issues, right? Whether it be cancer, whether it be the effect that it may have in diabetes, in terms of the effect that it may have in terms of cancer, in terms of kidney disease and so forth. So for us at the National Drug Abuse Control Council and the Ministry of Health, it's very important that we develop a national tobacco bill, added to the fact that we are signatories of the Framework Convention on Tobacco Control, and that is the piece of legislation that would protect our population in terms of regulating the industry, in terms of regulating marketing, in terms of increasing taxation to these products, but more important, in terms of protecting the lives of those individuals who consume and don't consume tobacco products.
Tobacco and being cool go together like hand and glove, right? Because tobacco contains nicotine, and nicotine relaxes the individual who consumes it either by smoking or otherwise, right? And so it is marketed in such a way where to be cool you have to smoke a Virginia Slim, or to be manly, you have to be a Marlboro Man, or to be cool, you have to be like Joe Camel, and so on and so forth. The point that I'm making is that throughout the history of tobacco consumption, it is marketed in such a way where we try to make it seem either more masculine or sexy in a feminine kind of way for persons to be able to consume this particular product. What is not readily told to the consumer, as you mentioned, the amount of chemicals that are in one stick of tobacco, one stick of cigarette, sorry, right? And the effects, the long-term effects of it. I don't know if Sabrina would remember, perhaps you would, having dealt in the field for so long. There was once a truth campaign where they ran ads that gave you specific information about the impact of tobacco consumption on human life, right? And I think we need more awareness campaigns like that, perhaps localized to Belize, but it's in learning that tobacco can lead to amputation of your leg, tobacco can lead to lung disease and all these other things that you realize, okay, maybe it's not for me, as cool as it's depicted.
And not only that, it's also ensuring that, one, the information is out there, and we believe that through the National Drug Abuse Control Council, we provide that education through our schools and community programs, initiatives, and also through our outreach services. But one of the hardest things to do, especially in our society, is to change culture, the culture of consumption. And not only talking about tobacco, but also talking about the culture of alcohol consumption and other substances, right? But for us at the National Drug Abuse Control Council and the Ministry of Health, we are very much cognizant of the fact that for us to be able to provide that information, we ought to ensure that we go far beyond what the industry is doing. And I believe that the theme for World No Tobacco Day 2024 is very important because the theme itself speaks to protecting our children from the interference of the industry. And that's very important because the industry as it is in one way or the other preparing the younger generation to be able to be consumers of tobacco products. And how do we do that? We ensure that we provide information to the younger population, but not only in terms of tobacco is bad and e-cigarettes is bad, but in showing them how tobacco consumption would affect their lives and their health on a long term. Because we're not only talking about how tobacco affects your health, but in terms of how it affects your economy. When you look at the cost of one cigarette, how much does it cost? I mean, 35 cents, 50 cents a stick. But if you consume one stick every day or a carton of tobacco products for a lifetime, you would have readily been able to invest that money that you use to consume tobacco in the construction of a house or in making sure that your kids go to school or something like that.
It's the same argument we'd have for alcohol consumption, right? Because you're looking at lifestyle choices and the fact that socially it's cool to have a drink or to have a smoke, right? And even now, if we could extend it to marijuana consumption, everybody perceives it as, oh, I'm in the school, I'm in the in thing when I'm doing that. I can recall fairly recently, there was sort of a counter campaign, if I could use that description, where across the region, tobacco products are being removed from being prominently placed on shelves. Labels were also discouraged or removed as well, so that the marketing and the branding of it is not as obscene as it once was back in the days. Can you speak on that?
And that is also part of the initiative that the Ministry of Health and Wellness has in the development of the National Tobacco Bill. The National Tobacco Bill, like I said earlier, doesn't only emphasize in terms of increasing taxation, in terms of making sure that the information is there that would deter individuals from consumption, but we're also looking at marketing and labeling, how we can ensure that through these products we will be able to market the dangers that tobacco poses on individuals who consume these products. We're looking that at least 3/4 of the package of a tobacco product would be earmarked exclusively to show pictorials of lung cancer, of any other sickness that are associated with tobacco consumption. So it's a very gigantic effort that the Ministry of Health is doing, and it will not only require the work at the National Drug Abuse Control Council, but it will also require a collaborative effort from a lot of stakeholders to ensure that whenever this bill goes to the House of Representatives and it's passed, that all of us are aware that tobacco is dangerous for us, but at the same time that it's our responsibility to ensure that we reduce consumption, but more important is to protect our young kids, our young people, our adolescents, to begin consuming at an early age, because tobacco product, just as alcohol, is considered a gateway drug, and it's just the start of serious things that may come if that individual continues to smoke tobacco products.
I think, Isani, about since you were talking about packaging, the packaging of the cigarettes that you would purchase, there's like in a little fine line.
The Surgeon General's.
Yes. Or the Director of Health Services advises that tobacco is dangerous for
yeah, like so small you can barely see it.
The National Tobacco Bill wants to change that, and it wants to increase the pictorials in terms of ensuring, like I said, that the message is visible, that the message is direct, and the message is readily observed by the population that are consuming these
What is the
products.
buy-in for this proposed piece of legislation?
Well, you are aware that we've been working with the National Tobacco Bill for many years, and I'm thankful that we are now seeing the light at the end of the tunnel when it comes to this legislation. As recently as a couple of weeks ago, the bill had its final drafting from the Attorney General's ministry. The Ministry of Health already has this document, and it's in the process of preparing to be elevated by the Minister to Cabinet, and then thereafter to the House of Representatives. It is the hope of the National Drug Council and the Ministry of Health that this bill would see the light of the day, all and for all, for the protection of the livelihood of our Belizean people.
Here's a situation. Perhaps this is a real life and ongoing scenario. Law enforcement, putting in place laws is one thing, enforcing laws is another. You walk into a grocery store or an establishment, there's a sign that says, no alcohol will be served to any person below the age of 18, right? Whether or not the grocer applies and abides by those laws is one thing. But there isn't a sign that says cigarettes will not be sold to any minor. So if I'm drinking and I'm smoking and I decide, okay, I'll send my child to the store and say, okay, buy 2 sticks of cigarette and buy a bad man, so to speak, right? The grocer may have an issue selling the child a bad man because there's a sign on the wall, but he'll come back with 2 or 3 cigarettes because there's no sign that says you shouldn't.
And hence the reason why the National Tobacco Bill wants to change that. We want to regularize the legal age of consumption of tobacco products, 18 years of age, but at the same time we want to regularize the accessibility of the product to our younger generation. At this point in time, what we are basing ourselves is that both the owners of the shops would work on moral and values so that they don't sell these products to these young people.
That's an uphill battle, Lesnar. I respect what you're saying, but when it comes to...
That's the reason why I said that we would need everyone on deck, all hands on deck, so that all of us would play our role to ensure that from the perspective of the Ministry of Health and Wellness, we are doing all that we can to be able to regulate and to create those policies that are needed to ensure that these things take action, right? But once these things are done, then the other agencies will have to do their role, the police department, probably a national licensing association for tobacco products, probably the Belize Bureau of Standards will need to do their part as well. Nonetheless, the whole idea of tobacco control is protecting the lives of the individual, and we could have all the legislation that we would want to have, because at the end of the day we're a country that has beautiful legislations, but implementation is another thing. But it really would rely on your personal choice in life. Hence the reason why the National Drug Abuse Control Council is very cognizant that whereas we are providing with the general population with the information that they need to have to make the right choices in life. It is up to you to make that choice.
I want to ask really quickly, Isani, about the involvement of schools in this, because as you mentioned, this year's theme speaks to tobacco consumption and of course the negative marketing and how it draws in younger people. Is the Ministry of Health and Wellness using this opportunity to include schools in on the campaign?
Yes, I mean, that's part of the work that the National Drug Abuse Control Council does. We ensure that through our Schools and Community Programs unit that we would provide all the schools with the information. We do go and make presentation. As a matter of fact, the month of May for the National Drug Abuse Control Council Schools and Community Programs, we earmark it exclusively for tobacco information. We go to the schools, we create programs, we ensure that the young people, specifically this year, that the team is revolving around children, that the children will be the ones that would be directing us in terms of how they would want us to protect their lives.
Interesting.
Let's step back a bit and let me challenge you on something you mentioned earlier, as a point that I find altogether interesting. You mentioned the idea of a moral or an ethical decision to be made by the person who is selling tobacco in this case. So my question is, do you believe that the dealer has any moral or ethical considerations when it's simply a business transaction, right? So you have someone who's selling crack to residents in a community. That dealer is not thinking about how it affects you. That dealer is saying, okay, give me the $5 and I'll give you the piece of crack. And it's for them a business. It's no different than if you walk into the grocery store and you order a pack of cigarettes and a bottle of rum. That grocer is not considering, oh wow, should I say it's bad for you? Should I say you're underage? Should I say you're old and you may be facing certain health complications as it is? No. That person simply says, okay, it's $20 or whatever, you pay, and you go about your merry way. Whatever happens with you based on the consumption is on your end. That's the scenario I'd like to challenge you on.
And I guess that it's very true, and at the end of the day, it's what we live in, what's happening in our country. But I think that how we would be able to counteract that and be able to strengthen that moral and that value that these business owners and shop owners should have is when they look at the legislation and they see that the fines for selling tobacco products to people who are below the age of 18 is will be very, very high when they are exposing the younger population to these products and so forth. So that is where policy and regulation comes to strengthen whatever we want to do and whatever we are doing to ensure that we protect the lives of individuals. I believe that any conscious business owner would know that whenever they are exposing young individuals, and I'm not only talking about tobacco products, but also exposing the young population to snacks that are not healthy and so forth, right? That whenever legislation comes and knocks at their doors and tells them, if you continue doing this, then these are the fines that you will be paying. I believe that that's the way how we're setting a pace to changing culture, to changing things that were done a certain way to a way that we can ensure that we can protect the lives of our people.
Let's go in a slightly different direction. I know we're winding on our time for this discussion. We haven't spoken much about the rise of e-cigarettes, the prominence of hookah bars across the country where people are seeing it as an alternative to actually smoking cigarettes, but it's equally, if not more so, risky and dangerous for human health.
We began to see the rise here in Belize in 2014 when we did our last Global Youth Tobacco Survey. In that specific survey, we included a number of questions and we wanted to test how these new and emerging products were being introduced in the country and how accessible these products were to the younger population. And we quickly realized that we had to do something quick to ensure that whenever we make the legislation, whenever the legislation, the National Tobacco Bill goes comes to light, that these new and emerging substances will also be included in this bill. And yes, it's one of those. It's one sector of the industry, tobacco industry, that is emerging rather quickly. And for us at the National Drug Abuse Control Council and the Ministry of Health, the one thing that makes it more alarming is that that sector of the industry is targeting more our younger population.
Precisely.
And when it comes to the information that is there in terms of comparing the dangers between traditional tobacco products and the new and emerging products, you would see that they are equal in terms of their danger, or a little bit more higher. At the end of the day, whenever the industry sells these new and emerging products with flavors, with school, you'll be much recognized if you're consuming these products. At the end of the day, the industry is doing a bad thing to the population, because at the end of the day, it is the younger population that gets affected. And whenever these young population grow and become adults and are affected through health, the industry won't be there to pay for their bills, hospital bills, right? So for us at the National Drug Abuse Control Council and the Ministry of Health, it's important to recognize that these new and emerging substances has to be included in not only the conversation, but also in the legislation for regulation and policy development.
Mr. Veos, as we wind down this conversation, let's quickly mention what this year's theme is for No Tobacco Day.
Well, World No Tobacco Day 2024 is celebrated under the theme protecting our children from the industry interference. And again, it's very important, this theme for this year, because readily we have seen the industry, how they use and how they manipulate social media to attract our younger population. What we're doing this year at the National Drug Abuse Control Council, we're continuing our annual May activities countrywide, but this year we wanted to do something different. We wanted to team up with different social organizations such as the Kidney and the Diabetes Society, along with other units within the Ministry of Health such as HECOPAB and also the Mental Health Unit and the Epidemiology Unit, to present a National Tobacco Forum. And the National Tobacco Forum is basically to show data in terms of how we are as a consumer of tobacco products, and also where we are in the region. And then we wanted to show how tobacco affects our health. And lastly, our third segment within the forum is we wanted to showcase where we are and where we want to go in terms of policy development, in terms of ensuring that as a Ministry of Health, we are protecting the lives of individuals who consume substance and who are not consuming these substances. This forum will take place on Friday at the IT Vet, and it coincides with World No Tobacco Day.
Is it open to the public to
It is
stop
open
in
to,
and hear?
yes, it's open to the public so that they can come and listen. Hopefully we'll be able to live stream it so that more would be able to have that information readily available. And if anybody would want to have more information about how to stop consuming tobacco products through cessation programs, they can always visit our outreach service at any of our National Drug Abuse Control Council office countrywide, and there they will be guiding them in terms of how they will be able to rehabilitate themselves in not only in terms of tobacco consumption, but any other substance that may be affecting their lives.
Excellent. Thank you very much, Mr. Veos, for stopping by. We appreciate the information and all the best on the projects being done with the NDAC.
Thank you very much.
All right, we're going to take another quick break, and when we come back, the conversation switches into furthering education in Belize. Stay with us. We'll be right back.